I don't even know if I can do on my
Yeah,
head.
you can.
Hello, I'm Olivia. I'm a student at the University of Cambridge, and this is my co-host.
Dama, and I study at Arts University Bournemouth, and I do photography.
And we're your hosts of the podcast Panic and Me. Today we're going to talk a little bit about antidepressants, and just because Dama and I are both on antidepressants, and so we're going to talk a little bit about our experiences and how it's been for us, really, because I think when I started taking them, it seemed like a really big step, and it was something that I really didn't know much about.
Mm-hmm.
Yeah, I mean, did you know much about?
No, I didn't know much about it, but I think it's a good idea that I did go on them.
Mm-hmm.
Even a lot of people take years to go on it, and it's better to do it sooner than later. I only started 2 weeks ago, so I'm very still new to the idea, but I'm very early in my mental health stage anyway, so that was a step, with your help, of course. It's been really good.
Yeah. And I mean, I'm still relatively new to taking antidepressants, so it's been a couple of months now. And we should probably tell them the specifics of what we're taking. So I'm taking 50 milligrams of sertraline, one tablet in the morning. And I have to take it in the morning, otherwise it gives me insomnia at night, which isn't great. And I'm sure we'll get onto side effects as we go through the video. But I've been taking this, like I said, for a couple of months, and I've definitely had a big journey through it, really. So, and you're on something completely different to me.
Citalopram, so 20 milligrams, which is 2 tablets in the morning.
Yeah, and I mean, you started on 10 milligrams for 1 week, and then you went up to 20, right?
To ease into the process. So, and because my milligrams aren't that much, it doesn't give me any side effects at all. But it is different for everyone. Like, I know your experience hasn't been very great.
So I started taking citalopram because I was getting basically lots of panic attacks, and low mood and things. But citalopram is known to be quite good for panic attacks specifically, and panic disorder. So I was prescribed it even.
What's citalopram?
Citalopram is particularly good for panic attacks, and but usually what they do, I think, when you start taking the antidepressant is you start on half dose. So they should have started me probably on a 25 milligrams for a week, but instead I went straight on 50 milligrams, and I felt really, really ill.
They threw me
into the deep end. I had so many side effects. I had headaches, nausea, vomiting, stomach aches. So my anxiety actually got worse for 2 weeks before it got better. And every morning taking this pill, I was thinking, why am I doing this to myself? But kind of on the forum, on forums and online, I'd been seeing people say, just stick with it, it's really worth it. On the first day I took it, I phoned NHS 111 option 2, which is the mental health service here in Cambridge, and spoke to them, and they were really nice. Mind Run, a kind of listening service that I used for an hour, and she was really, really lovely and just told me to kind of stick with it. And then on day 5 or 6, I phoned up my GP and I said, I cannot deal with these side effects anymore. I really want to carry on. And she told me to go down to 25 milligrams for 4 days, which did help. And then I went back.
And you did that?
I think I'd done it for 2 or 3 days.
Okay.
Just to take the edge off the side effects.
Yeah.
So it's important if you start taking antidepressants to stay in contact with your GP.
And that you don't stop, because then the side effects will be even worse. But also, a lot of people will say there is a lot of side effects. Like when you told me about it, I was
Mhm.
a bit scared because obviously, like, no one
Yeah.
wants to go through that, but also don't be put off by that.
Because you've experienced none.
Yeah, I've experienced none, so we're completely different,
Mhm.
you
Yeah.
know, case scenarios, but don't, even though, be prepared that it might be crap for a bit,
Yeah.
but there is light at the end of the tunnel,
Yeah.
and it will get better, won't it?
Definitely, because even though I reacted really bad to it in the first couple of weeks, it was the right medication for me. And it's important to trust your GP. You know, because now, kind of 6 weeks later, I'm feeling so much happier. I'm so much more able to engage with therapy. Literally, my physical symptoms are gone. It's literally got rid of my panic attacks, and it was a really, really good decision. And I've been going through therapy for kind of like 4 years or so. So medication was something I saw as like a last resort. But now that I'm looking back, I wish I had taken it alongside therapy sooner, because it allows the therapy to actually work. And actually, it's quite good to do antidepressants and therapy together.
Mm.
Scientifically, it's been shown to, reduce your symptoms a lot quicker. Yeah.
When did you start feeling better?
So I think I started feeling better. I think my body had quite a strong reaction to the medication.
Mm.
So I started feeling better basically after 2.5 weeks or so. I definitely started seeing the benefits. And I think at the peak of it, and I'm thinking of kind of increasing my dosage to 100 milligrams, but I'll talk to my GP about that, because I still have some symptoms of anxiety, of course. But yeah, I'm so much better. I'm so much more motivated. Kind of, I was telling Demonte how kind of like 3 months ago, I sat down to do my dissertation and I just cried
Mm.
because it was so overwhelming, because I just felt like I couldn't do it. And now, kind of, I mean, now that you're stuck here with me during
So
lockdown,
much better.
you've watched me over the last 2 weeks do, 20% of it or something,
Yeah,
whereas for
yeah,
3 months
and
I
you feel
felt like I
so
can't do
much
anything.
better. But I think you have to have therapy with taking the
Mm. Yeah, because
medication.
I do see antidepressants as it masks the underlying problem, right?
But they don't always. Do they fully disappear, or is that something
What
that
this
you need to work on personally yourself
Yeah, I
as
think
well?
probably you have to work on your symptoms yourself as well. I mean, have you started feeling any positive effects of 2 weeks in, or?
Yeah, I think so. I guess it's hard to tell because I
Mhm.
am here with you. We are keeping busy all the
Mhm.
time. There's always something to do. Um, Especially even in lockdown,
Mhm.
we're thinking of new things like this.
Mhm.
So that's already making a positive impact because I'm so much more motivated to want
Yeah.
to do things and get my creativity out again. And definitely, I feel like I'm feeling better. But there's still a bit of time to
Yeah.
improve.
So in general, antidepressants take about 4 to 6 weeks to fully work. You do sometimes see an improvement before then, but you need to stick with it for kind of four to
Gotta
six
be
weeks.
patient.
You've got to be
Yeah.
patient, and I know when you're going through. I know for me, 3 months, 2, 3 months ago when I started them, 4 to 6 weeks felt absolutely impossible. I felt
Mm.
like I could not feel like this for that long. And I definitely didn't feel like I could deal with symptoms, side effects on top of my anxiety. But despite feeling like I couldn't, worked on that and got through it, and I'm really, really glad I did. And now for a few months later, I'm feeling a lot healthier and a lot happier. So if you do think antidepressants is something for you, like Damon says, you really do have to stick with it,
Mm.
despite it being. And I mean, my GP told me that I've got to stay on mine for about 6 months. Was that similar with you?
Yeah, 6 months to a year. So it is a long term commitment.
Mhm.
My GP didn't really tell me much, but obviously you
Yeah.
Google it, you talk to the pharmacist. So yeah, don't be afraid to try or take that step
Mhm.
um, to feel better.
But as you say, it is a long-term commitment, and it's
Yeah.
important to not start if you don't think you're going to be able to keep it up for six
Yeah.
months to a year. because the withdrawal effects of antidepressants can be quite bad as well. So if you do start an antidepressant and you decide it's not right for you, obviously that's absolutely fine. But you need to talk to your GP about coming off of it. Because you need to be, like I say, I was thrown into the 50 milligrams. If I just stopped cold turkey now, I'd feel really ill again. But what they'll do is they'll, put me on 25 milligrams, maybe 10 milligrams, and then stop me, rather than me just stopping like that. And you would have the similar thing with citalopram.
So there is a lot of stigma about antidepressants, and I certainly didn't even know that, how they work or anything like that. And there is a bit of a stigma, I feel like.
Definitely.
I've heard people say like, oh, it's for like properly sick people and the kind of thing. When I hear antidepressants in my mind, I imagine these scenes of like these people curling up in a ball and crying in the shower and, in a dark place, a room. They don't leave the house or even leave their room. I painted this weird picture of some photographs I've seen of people representing depression and anxiety. But you don't have to be in that fully dark place to start. Yeah,
definitely. You don't need to get to the point where you're really, really struggling until you get help. And antidepressants are one form of help. And we will do another video on therapy as well, because I'm a big advocate for doing therapy and work other than just antidepressants. But like Damon says, I have a mental illness. I'm a student at Cambridge. I do volunteering. From the outside, you might think that I'm coping all the time.
Yeah, you wouldn't even tell. I couldn't even tell that you struggle with all these things.
And you're my best friend.
Yeah,
exactly.
Yeah, we literally don't know. We could be walking past so many people in the street, and then they suffer, but they just look like normal people because
they are normal people.
Yeah,
because it's a very normal thing.
Yeah.
And I mean, antidepressants are one of the most prescribed medications in the developed world. So, and yet no one talks about it. When I said to people, I was very open about my taking medication. I think we both are. I was told, oh yeah, I take that. I take antidepressants. Oh, I actually take sertraline. Exactly the same as you. It's tough for the first 2 weeks, and I think that's why we wanted to film this video specifically, because antidepressants can feel scary, and as you say, they're so stigmatized.
There's a big stigma, but even I don't know what the percentage is in America, but so many, more than half of people take antidepressants, and it's and it should be be able to talk to people more freely about it, but I don't know why there is such a stigma, or what you guys think about it. But
definitely.
Have you had stigmas about antidepressants?
Have I had stigmas? I think in my mindset, I'm very open. And I try to be very authentic about myself, and I surround myself with people that support me. So I haven't personally, I've been very lucky, touch wood, to not experience any kind of stigma directly, to be honest. I've been very lucky to have a great GP. As you said, yours wasn't as descriptive, or mine said, have you done research on antidepressants? Which one do you want to go on? Whereas yours kind of just prescribed it. I've had good therapists, and everybody in my life knows I've started antidepressants, and it's not a big deal. How about? And I mean, I'm very open. But I know that there's maybe some people in your life that you would feel
I would not tell
telling.
them. It is a difficult topic, and because of how people think about them, some ideas about the antidepressants isn't great, and I don't know why. It just should be more open and free to talk.
It should just be you take antibiotics when you've got an infection.
Just taking that.
You've got a biochemical issue in your brain, so you take medication to help you. And honestly, if you talk to people about it, you'll be surprised how many people do. An awful amount.
Definitely, since I've been on it, I've realized this person is also on it, and it's you find people around it because it's another topic of conversation. You can talk to people.
Yeah, definitely. But I think that's probably
so we're gonna end the video here. And thank you for watching.
Please let us know if there's anything else that you'd like us to cover, antidepressant or otherwise. And we'll get to making a video for you guys. Thank you so much. Have a lovely
Thanks.
day. Bye.